Well, as we've reported this year, flu shot is only about 23% effective. It doesn't stave off the most common strain of flu doctors are seeing this year. However, doctors still recommend getting the flu shot. And here to talk about that and more is pharmacist Janine Amoya Pigliacelli of Rite Pharmacies. Hey, Janine, how are you?
Hi.
Nice
Thanks
to see
for
you.
having
Welcome. Now, there's still benefits to getting this year's flu shot. We're into the season, well into the season. Talk about that. Why are there still benefits?
Right. There's still benefit in getting the flu shot. The typical flu shot has not only one, but there's 3 different flu strains in there. Just because the one strain isn't effectively covered, if we get exposed to the other strains, you'll still be protected. So don't rule out the flu shot just because, they missed the mark on one.
How active has it been where you are right now, people coming in to get the shot? Do you seen a nice steady stream? Or?
Yes, we've seen a lot of people come in. A lot of people ask that question that you are raising with us. I got my flu shot and they said it's not working. And did I get it for nothing? And my answer is no. You're not only protecting yourself, but you're protecting the children around you, the elderly people. 65 and older have a lower immune system.
Sure they do.
So, it's not just yourself, it's the community around you.
Now, other than getting the vaccine, how can you protect yourself?
Well, you can practice hand washing. Usually say sing happy birthday 2 times, and that's sufficient amount of time. Alcohol-based hand sanitizers, always good to keep in your pockets.
Now, that's only good for 15 seconds, I hear, after you put it on. Is that true?
I mean, it's better than not
using it at all.
If you can't wash your hands with soap and water, that's the alternative. The other thing is if you sneeze or cough, obviously cover it. Tissue, cough in your elbow. Disinfect anything that you think somebody might have touched or contaminated.
Now, how do you know it's the flu and not a cold or virus?
Flu tends to come on really quickly.
Okay.
Like you'll be fine one day, next day you feel like a truck hit you. Fever, chills, soreness. A cold usually comes on a little more slowly. So you might have a sore throat, and then the next day you have the runny nose. So, and the flu is more severe. Symptoms are much more severe. You might be out of work for 1-2 weeks.
And how do you treat it? If you have the flu, how do you treat it?
If you have the flu or you think you might have the flu, it's really important to go to your doctor right away because they do have drugs to treat it, antivirals. Tamiflu is a big one, Relenza. And again, get to your doctor right away. Don't wait. The faster you can catch it and use those antivirals, the better.
That's the key. Do not wait. Janine,
exactly. Thank you so much.
Thanks for coming in. Appreciate that. For more on flu shots and flu prevention from Rite Aid, just go to cbsphilly.com and click on Talk Philly. Here's Kate now with your forecast.